like for religious reasons and all of that. So these are like, it's good we know the causes, but we're not going to dwell on it. Then gender inequality, for example, not wanting to spend equal money training a girl child as you would do a boy child, thinking that it's not a good investment. That's another thing. Then low female education, obviously, if that girl is in school, she wouldn't be under that condition or situation. Conflict and insecurity that is always ravaging our society. We see that a lot here. And unwanted teens pregnancy. I've seen cases too where the teenager gets pregnant, the parents force her to go live with the guy, and from there they start a family, people that are not even ready. So that's also a big issue. And I think that's not the best way to solve that. So we'll see the next page and we'll be talking about the health implication of early child marriage now. So talking about the health implication of early child, that picture you can see a baby, literally like a baby taking care of a baby. So health implication of early child marriage, we're going to see it in five facets: the maternal health implication, the neonatal and child health outcomes, the meta and psychological effect, sexual and reproductive health risk, the circle, that it's like a vicious circle, how this circle keeps perpetuating itself. So we'll see the maternal and health implication. When we talk of maternal now, we're talking of the gay child, the premature, or the child that is being forced into marriage now. Because obviously, once you get married, the next thing, especially in this our society, everybody keeps and starts asking, when are you going to give birth? Are you still not pregnant? And these children that get into this institution too, they are not exempted. So talking about the maternal implication, um, we can see that there are a lot of, the next page we'll see that child marriage is closely linked to early child pregnancy, which carries substantial health risk. Actually, from a research done, you can see that all adolescent pregnancy or teenage pregnancy, especially in this part of the world, are mainly like up to 90% of teenage pregnancy in this part of the world is by, okay, there are young ladies that have been forced into marriage. They are fed um people that were forced into early childhood marriage. The remaining 10% maybe just teenage pregnancy, but the bulk of it, 90%, is by girls that are in this child marriage usually, and they face a lot of health issues that we're going to be seeing briefly. So adolescent girls, the main reason why these ladies or these young girls are predisposed to these issues are, one, that they are not biologically developed for childbirth, whether psychologically, anatomically, like their body, even hormonally, they are not yet ready. Maybe they are just starting menarche, and they are just starting puberty. They are not really ready to birth another human being. That's why you see a lot of cases of obstructed labor, because of, there's what in medicine we call cephalopelvic disproportion, which is because the pelvic is still growing, especially this period, that period between 16, 17, 18, 19, 20. That's when the period, sorry, I mean, that's when the pelvic, when I talk of pelvic now, I'm talking of the region between the pubics, the private part, and the womb. That's the uterus that connect the womb to the private part. That's usually the exit where the baby will come out from. So that's the period that it assumes its normal growth and all. So this period that this child is being forced to give birth, that growth has not yet occurred. It's going to result in that disproportion, cephalopelvic disproportion during childbirth. And you even to complicate matters, most of these ladies don't even, most of these girls don't even get to go for antenatal clinic. They don't get to be delivered by experienced obstetricians. They either end up in these local birth attendants that don't even know what cephalopelvic disproportion means. They keep telling them push. I've even heard of a case where they sat on the girl's stomach, pushing and forcing the baby to come out. At the end of the day, either the baby get asphyxiated or baby could even die. The woman comes down with a lot of complications, PPH, postpartum hemorrhage, that's bleeding, or even end up with fistula. That's urine leaking through, that feces leaking through the hole that urine is supposed to come from because of the injury, because they are lying side by side. So when this happens, it can cause a hole or breakage in those different tubes, and they now connect. You now have feces, that's excreta or excrement rather, leaking through the place that urine is supposed to come from involuntarily and all of that. So a lot of things can go wrong here. So that I don't dwell more on this, we also talk on uterine rupture because of this. We talk of fetal distress, demise, and even we've talked of the fistula, obstetrics fistula. Even talking of the adolescent pregnancy itself, just to create awareness, adolescent pregnancy, because the body is not yet fully formed and ready to take care of, because at this adolescent time, this is when the body is undergoing rapid growth, needs a lot of nutrients and all. The lady in question just started having menses and all, needs a lot of iron for hemoglobin synthesis and all. Now you are bringing another baby inside of her. They are going to be that is not even enough in the first place. So they are at risk of coming down with pregnancy-induced anemia or anemia in pregnancy, which can overcomplicate things too. So generally, that's why adolescent pregnancy is called, the next page now. So adolescent pregnancy is termed high-risk pregnancy. So they're prone to anemia in pregnancy. They are prone to hypertensive disorders of pregnancy, like we hear of preeclampsia and all the complications. All of these terms we may not be able to break down because of the time limits we have. Then preterm labor, they are prone to preterm labor. We'll see all of this in the next page, in the next slide. Also, they are prone to postpartum hemorrhage and sepsis. And it is of note to say that adolescent pregnancy has a very, very higher risk of the mother who is pregnant, because obviously the body is ready as at that time, unlike now that the body is not yet ready. And to complicate issue again, because most times you even find all of these things in low income setting. Most of these women don't have access to proper antenatal care, and this even worsens the whole thing overall. Because I will just throw this in before I proceed to the next slide. If you ever come across a woman, a child woman, let me put it that way, that has been forced into marriage because of the kind of society we live in. Because actually, according to the Nigerian law, and I tried to look through it, that kind of marriage is actually non-void. It's under the court of law. It can be dissolved because it's not recognized by the state. But I don't know, we have a limit to what we can do, but the most we can do is make sure if we ever see someone going through that situation, we support that woman that is a child. If it's just to help her get proper antenatal care, or to make sure that she doesn't end up in complications. So let's continue, please. We'll see the mental and psychological effects. So one of the major one is depression and anxiety disorder, because this child doesn't even understand the word yet. You are forcing her into all of these things that she doesn't understand. She doesn't understand the concept of marriage. She may not even understand what is expected of her in that institution. And she's going to live under anxiety disorder. Most of them might even become very ashamed of themselves. Social stigma, you see a lot of pictures. Some of them, they feel so shy, and because they don't understand what's going on. Social stigma, people make derogatory statements about them at all. And also, these are people, human being like you and I, they have goals, they have dreams, probably wanted to live that kind of life they were born into, but now they've been stuck there. So because of unrealized potential, they have this low self-esteem. A lot of psychological issue arise from it. And also the bringing them into this early responsibility when they are not even yet ready can also have a toll on their mental health. Then also there's increased risk of domestic abuse, because in this setting you usually find an 80 years old man marrying a 16-year-old lady, a 40 years old man marrying a 14 years or 13-year-old girl, all of these things. And in that kind of setting, that woman has no say. She can't even request for simple things or make complaints of what she's not okay with. Even at that, she's still being domestically abused and a lot of cases like that, and she can't even talk to anybody. Then there is poor health-seeking behavior too. I've heard of some culture in Nigeria and also religion influenced behavior where a woman cannot go to the hospital without her husband accompanying her or without her husband granting her the permission. And you usually find it among these kind of settings. You can only find it within a marriage between an educated lady and an educated man, probably between all of these things anyway. We understand what I'm saying. So we'll move on. I hope I'm still within time. Let me just quickly, I'll try and be faster now. Then we'll quickly talk about the sexual and reproductive health risk. The sexual and reproductive health risk, like also ladies that are involved in this kind of setting, this setup, young children, the men are usually more experienced, probably 4 or 5 times their age. And these men have been sleeping around with different kind of women. Probably they've even had 4 wives before. But these ladies are usually virgins. They don't even know anything. So they are increased to the risk of sexually transmitted infections because most of these men, you don't know the kind of reckless lifestyle they've been living. Now they get this, they will not even want to use protection or anything because obviously they have the autonomy of she's my wife, she's my property, because that's the mindset of most of these kind of men. Not to insult anybody, but it's something that education and awareness can help to correct. So they are at risk of sexually transmitted infections, and they they they, they may be forced into sexual exposure that they are not ready for because they don't have a say and all. Also, they tend to come down with unintended, closely spaced pregnancies because they don't have autonomy over their sexual desires. The number one culprit here is cervical cancer. Do you know that early coital, like the age at which you start knowing the opposite sex, you commence sexual activities. The people that started having sex at at a younger age for women have a higher risk for coming down with cervical cancer, and most of these women might actually like be prone to that risk. Then lack of reproductive autonomy, like they may not even be able to ask their husband to use condom to prevent unwanted pregnancy or space or use family planning, or they may not be aware. So the second, how does this affect the economy? I'll just read this so that I'll be fast. When they get married prematurely, she almost always drops out of school, which limits her education and future earning potential. As a result, she becomes economically dependent and is more likely to raise children in poverty with limited access to education and healthcare. These children, especially females, are at higher risk of repeating that pattern again. And this now perpetuates a vicious cycle of poverty. That's one thing we see, especially in some regions of the country and the continent. So early child marriage is not just a consequence of poverty, it's also a driver and perpetuator of what? Poverty in across generations. So quickly talk about prevention and management, because there are already people that are in it as we talk now. Initiatives and NGOs like this can actually help mitigate against this by creating awareness like this. More of this can be done. Aside that, looking out to reach out to people in the grassroots, even using their languages, interpreting and letting them know, because most times it's ignorance, they don't know better. Then that's education of the girl child, and the girl child education should be made a priority. Legal enforcement, because there is a child act law in Nigeria, but it is not, maybe the lawyer will speak, the barrister rather will speak more on this. It is not applicable to all the states, it's only applicable to the states that have imbibed it. So many states that this thing is still being practiced, you can't even prosecute these people because the law is not effective in those states. So this law that are in our constitution should be enforced. Community should be engaged and public awareness should be made, especially at the grassroots level, people that need information the most. Then economic empowerment. Most families that want to give out their daughters because they are seeing these ladies as liabilities. They will just want to give it to anybody they think may be able to bring a goat or whatever they can exchange, and without really caring much about the future of such ladies. Then access to reproductive health services for those that are already in this boat, and those that teenagers and adolescent ladies as a whole. So in conclusion, I would like to remind us that child marriage is a major public health challenge. It drives adolescent pregnancy, which leads to maternal fetal and neonatal complications. Then it perpetuates a cycle of poverty in a generation. Hence, preventing it will improve overall life outcome. Thank you for listening. Please, if you have questions, I would like to hear them. Thank you very much once again for the opportunity um, to speak to the organizers, and thank you for listening, everyone. God bless you all.
Wow, wow, wow. Thank you, Dr. Jude. Thank you for that very insightful session. I can actually relate to what Dr. Jude just gave us. With my years of experience in labor world, have actually witnessed situations where underage girls come down with pregnancies after undergoing prolonged labor. And you know that most of these girls, when they become pregnant, they will register in a peripheral hospital where there is no professional to manage them. And by the time they will be presenting at the tertiary hospital, the condition will have gone bad. The situation I witnessed sometimes ago was the case of a girl that already had intrauterine fetal death. She has labored for a long period of time, and the baby already died. And on presentation, nothing much could be done for her. So we just needed to rush her to the theater. And you can imagine the kind of pain having to go through emergency cesarean section. At the end of the day, there's no baby to show for it. You don't want to witness this. So, Dr. Jude, we sincerely appreciate you for that session. Thank you for your wealth of knowledge and wisdom. We appreciate you for that session. I don't know if anybody have question or query for Dr. Jude at this junction before we move to the next presenter, please. If you have any question, please raise up your digital hands so we can quickly take that. All right. I think I can see a hand.
Hello, good afternoon, everyone. Good afternoon, Dr. Jude. Good afternoon to the barista. Good afternoon to my professor, Professor Ang Sheyang. And good afternoon to our mommy. I don't know if everyone can hear me. Hello.
Yes, I can hear you loud and clear. Please speak
Please
on,
go
we can
ahead.
hear you.
Oh, okay, okay. Good afternoon to everyone. It's insightful and educating what I've heard this afternoon. But my question goes to Dr. Jude. Dr. Jude, can you hear me?
I can hear you. Go on, please.
Okay, I used to like your section, and this is what I want to ask. This issue of uh, early child marriage, if I could get it right, I don't know, is there anything that NME as a body, that's Nigerian Medical Association, is doing to curtail and avert this, because especially those of us that stay in the north like this, we see these things happening and they are real. You just see a child very young getting old to getting married to an elderly man, probably because of money. Me, I think it's poverty mentality actually. So is there anything that the NMA can actually do? Probably maybe work with the National Assembly and see if they can promulgate a law that can really help in this. Thank you very much.
Oh, all right, thank you for that question. Dr. Jude, you have something to say
Okay.
concerning that?
All right. I'll just quickly answer that, and because of time, thank you so much for the question. Is there anything NMA is doing as a body? Actually, there is a there's an arm of medicine that they call public health or community medicine. These are people that really go to the grassroots to look at what is going on there, try to render help in any way they can. So these public health officers, they are doing a lot when it comes to all of these concerning issues, but I can't categorically say this is what NMA is doing as a body. But are doctors actively involved trying to mitigate and reduce this? Yes. And are there policies that are being pushed to try and make sure that this is curtailed? Actually, yes, there are, and a lot is being done at the grassroots level. But truthfully speaking, we need to do more. Thank you so much for your question.
All
You're
right, thank you, Dr. Jude, for doing justice to that. A lot is going on working against child marriage, and one of it is what we are doing here today, advocacy. Without further waste of time, I would like to move straight to the next session. The next presenter will be talking on education interrupted, how child marriage destroy girls' human capital and national development. This session will be taken by a research analyst who is currently working with Policy Innovation Center. I tell you, this person has been to several states in the country, so he has experience and he knows his onions. Please join me as I make welcome Mr. Sheyi Awo to take the next session. Over to you, sir. Thank you.
Thank you very much. I want to welcome everybody to this meeting. I'm Dr. Jude. As you have seen my slide, they have helped me out. Probably this one will cut short the time I'm going to spend looking at the economic implication of child marriage. I want to welcome everybody to this event that has been put together by Awareness Foundation. Uh, I'm happy that we are able to join. Without wasting much time, um, the topic before us this morning or this afternoon is a very emotional one because we are talking about child marriage. But it's easy to say, child marriage, I'm not affected in any way. My sister is not married at a young age. Nobody in my neighborhood is actually doing that. So why should I really care? I hope I'm much more audible now. Initially, I was using headset. Okay. So what was I saying? It is easy to say I'm not affected in any way. I am none of my people are affected. But at the national level, we we are all affected with this issue of child marriage. And we could say the girl in Kano who got married at the age of 10, how does it concerns me? Seriously, it concerns us seriously. And this presentation is going to show is going to show how it really affects all of us. Nigeria just decided to set a national goal, and national goal is that we are going to the party of $1 trillion GDP. I hope we all know that. I hope we all know that Nigeria is um, trying to they're trying to create an economy of 1 billion GDP. And how are we going to do that? The most important factor of production from our regular economics is human capital. So I want to see if you can see my screen now. Confirm correct if you can see my screen. Yes, you should be able to see.
Yes, we can see your screen now, sir.
Okay. So like I was saying, Nigeria is trying to develop our economy to $1 trillion GDP. And we need every hands on deck. We need male, female, boys and girls. We need everybody on all hands on deck to be able to achieve that. So how are we going to achieve this? How are we going to do that? How are we going to do that? Research from Child Life 2024 revealed that early and forced marriage stripped 2.43% from Nigeria annual GDP because people who are supposed to be contributing to the economy, to the GDP, they are somewhere in a village, married at a very young age because they are forced to marriage or cultural and religious norm has forced them to. Sorry, excuse me, give me a minute. All right. So this is not a social crisis only. It's a profound fiscal leak that hinder national prosperity and infrastructure growth. As a matter of fact, child and early forced marriage is costing annual economic costs of close to $10.8 billion every year. Every year. Now, another shocking realities of child and early forced marriage is that 44% of Nigerian girls they get married before they reach 18 years old. And in the world, Nigeria has a very staggering statistics of being the third highest highest number of child brides globally. I'm sure this is not a statistics that is very good. Then 60% of these girls are even married before they clock 15 years old. And this demography is like 5 to 7 more times likely to face threatening birth complication, like Dr. Jude has made us know. It is a fact that there are regional development gaps. For instance, the 50% prevalent rate is very common in the northwest and northeast, whereby southern regions still contribute 10% to child and early forced marriage. Okay, the impact is that the trap in the north this trap is not in a circle of intergenerational poverty. So when they are mentioning GDP of Nigeria, they won't say the north only, they will calculate both the north and the south, and that's really how much it concerns us. Okay. Statistics told us that marriage is the number one reason for female to drop out from school. I can remember a couple of my colleagues when we were in school, a lot of them that drop out who are female, they drop out either because most likely because they got pregnant and their parents just told them you have to go to your husband's house. Even in the north, they don't even get pregnant. They just go to their husband's house. You could be surprised in a state like Cross River State, there's something they call child loan. Your father takes loan from his friend. If your father cannot pay the loan back, your father will give your sister out in marriage. It's happening up to today. Then child and forced marriage reduces secondary school completion rate. That's why we have so much people who are primary school older rather than secondary and tertiary institution because it reduces it by whopping 23%. And Nigeria effectively reaches 24 million potential economic contributor. Imagine that we this effectively benches 24 million people to become potential economic contributor. Then lifetime earning erosion. 12% average reduction in lifetime earning for women who marry as a child compared to those who delay marriage. We have found out that girls who get married have 12% lower tendency to earn. Just imagine that an Okonjo-Iweala has been married as a child and he will not be able to reach that potential. Do you know how many Okonjo-Iweala so this time around, I'm not even talking about the health implication. I'm talking about it has significant economic implication. For instance, truncated education leads to low skill labor. And we know that in the ladder of labor,
the low skill labor, they are the least paid, and they are so plenty. Because they are so plenty, they are the least paid, and it makes poverty to just remain in that cycle. So depressing aggregate demand and tax revenue, either we tell ourselves the truth or not, it is the poor people that are paying tax more in this country. I don't want to go to that this morning. Okay, then we also have the public health implication, and I'm looking at the economic value. You will notice that even the budget of Nigeria is catering for health issues that are avoidable if there are no early child marriage. For instance, maternal risk. Adolescents are 5 to 7 times more likely to die in labor than women in their 20 years old. So government puts a lot of money to make sure that maternal health care is strong, just to cater for adolescent girls more. Number two, even the vestibular cost is very expensive. We spend high fiscal spend on treating preventable obstetric fistula cases. These are preventable. If a child did not marry at a younger age, fistula, or we could be VF cost will not even be there. We can use that money to actually do something else in our country economically. Then high risk of nutrition in offspring, reducing future productivity. Even the children they will give birth to, because these people are children giving birth to children, their children are malnourished, and the cycle will continue. If those children manage to go, they will also follow that trend, and it's economically draining our country. Okay, so if a child gets married early, the fertility rate increases. For instance, a child that gets married at 12 has higher probability of giving birth to 7, 8 children. Compare if he gets married at age 20. This one, the implication of this is that the population will explode, and we have so many people, and we have children we cannot cater for. For instance, if you marry below 18, you have 44% fertility rate. Below 15, we have 16. And if you can marry at 18, we have 40. So the higher the age, the lower the fertility, and the lower the population explosion. Okay, so our fertility rate 4.8 per woman. In Nigeria, we have 4.8 fertility rate for each woman. Just imagine the number of women we have in this country. If each of them give birth to five children, that means I cannot even try to do the math of how the population will look like. And we have this figure because the children marry at a very early age in this country. So this even is even making per capita GDP growth mathematically difficult, because their revenue we are generating and the population of people who want to take from that revenue is not matching. The ratio we are producing lesser than we can actually consume, and that is why our economy is like this. Okay, then national priorities. We have economic loss to child marriage. We have the total budget of education in 2024. See the way it's low. The total health budget is low, but we have very high statistics of early marriage. Nigeria loses more to child marriage than it invests in both education and health combined. If you combine the budget on education and budget on health together, the economic losses that is draining us through child marriage is more than even if you combine the two of them. Okay, so pathway to economic dividends. How can we just do this at the institutional level and at personal level? Number one, we should try as much as possible to keep girls in school and delay marriage. So if you can do that, secondary school completion rates will rise and labor forces will improve, because the more educated you are, the more skillful you become, and the lesser poverty we have. Then, as if you delay marriage, we will find that the fertility rate will drop. Dependency ratio will also shift significantly, because we will have our revenue matching the population we have. Then at the end of the day, the overall impact is that Nigeria, it will not trigger demographic dividend. All right, so these are my recommendations. Number one, at the policy level, I'm sure Dr. Gladys will help us look at the legal aspect, but I know that there's Child Rights Act that's needed to be enforced. If you can do that, the rate of return is going to be high. There will be legal stability. I know there are some legal framework. I don't want to go into that. Number two, government should also think of incentive to keep children in school. give them food. Nigeria started a school feeding program. Nobody is even hearing anything about it. I've never seen any child being fed in a very long time. Maybe like five years ago. That was the last time I heard about. And that program that was done by the Buhari administration. No, I've not even read the impact. I've not read anything on the evaluation of that program. You will see at that time more children will stay in school because there's incentive to keep children in school. And at the personal level, if you see a child that is not going to school, you can keep that child in school. Public school in a place like Ogolada is less than 10,000 naira. If you keep that child in school, you are indirectly also adding to improving the skillfulness of the Nigerian labor force at the end and eventually keeping them out of early marriage. The earth infrastructure, urban areas, so rural areas where we have the majority of this child marriage, they have just PHCs, and PHCs are not really equipped to take care of earth implication that arises from child and early forced marriage. Government needs to look at that as a matter of urgency. In conclusion, we cannot build a new Nigeria on a broken dreams of child bride. Thank you for your attention. I will be taking questions from here.
Wow, wow. Thank you very much for that session. Really insightful. You know, it pains me when I get to hear that our girls have been deprived of their opportunity to go to school. I can tell you that one of the reasons why the country Nigeria is still where it is today is because we have refused to pay attention to this major issue, child marriage. It's as if everybody is saying it's not my business. We are waiting for the next person to do something about it. Whereas until you stand up to do something, nothing will be done. So thank you very much, Mr. Sheyi, for that insightful session. We are most grateful for bringing us to national development, the impact of child marriage on our national development. So at this junction, I will give room for question and query. Do you have any question or query for Mr. Sheyi, please? I saw one hand raised, Mr. Is it Amodu now? Please, if you are still interested in the question, please go ahead. Mr. Daniel, I can see your hand. Daniel, unmute yourself and ask your question, please. Okay. Who has asked question for Mr. Sheyi? Please, can I see
Hello.
your digital? All right. Go ahead with your question.
Good afternoon, sir, Mr. Sheyi. This is my question. I think to something to the issue of this early girl child marriage. And I don't know, there are parts of this country that they believe that uh, uh, boys are more valuable, let me put it that way, than girls. So the man, although the man is a Muslim, and he said something, he said that boys are more reliable in holding their father's property than the girls. So I told him to give me some points. He was not able to convince me. Now bringing it to the national development, what is the government actually doing? Because this issue of uh, girl child marriage is an important issue. You discover that there are some families that they deliberately don't want to finance or encourage the girls to go to the school and learn. They believe that at the end of the day, they end up in the kitchen and they end up marrying, just giving birth to children and raising children. That's the purpose of girls. And I try to educate him and tell him that that is not the reason. And you discover that this thing now boils down to the national development. That's why you see that the men want to see that they are the one developing the country. And if you look at some of these countries that are developed in the world, you see that women participate more in national development than even men. Because men, sorry to say, most men, not all men, they have this corrupt tendency that when they get to power, their own is just to siphon money, steal and all. But you see, an average woman that has that fear of God just want to put things right. So what is government doing? I'm talking state per state now, from north to the south to the east to the west. What is the comparison of this girl child development? Which state, which part of which zone of the country can you say is doing better than the other? Thank you.
All right, that's a very brilliant question. And in fact, you have even answered that question. What my presentation has brought to bear is that there's devastating implication of child marriage on economy that nobody is even paying attention to. We don't know that it's hurting us in that manner. Speaking of what government has done, I will allow Dr. Barrister Gladys to talk about that because she's actually focusing on the legal framework, and that is institutional, that's government, what they are doing at their own level. So I would not want to preempt. When she comes on board, she'll be able to answer what government is doing. But at the policy level, I can also say that all the states in Nigeria, how many of them are domesticated the Child Rights Club? And don't forget that the the enforcer of this is a social norms and religious norm issue. And most of the time, these norms are much more powerful than even the Constitution of Nigeria. Government have law. And we don't forget that we have even have laws in Nigeria and enforcement is an issue. So we have those myriad of issues. But what we can decide to start doing is like what we are having this seminar, trying to raise awareness at personal level to see how we can shift behavior and shift norms to tell them that whatever you are doing, or to tell whoever is, for instance, somebody that his daughter got pregnant at 15, the normal thing for that person is to just send the girl to her husband's house, which is a very wrong thing, which I don't even want to, which I don't want to go into now, as a matter of fact, because that's child marriage, that's child and early forced marriage. So there are policies that government is putting in place. I can't say which state is doing better than the other. I've not done that, but the statistics is there. If you check, you will see which state has more child bride than the other. So that will give us a straight jacket answer. The issue of child marriage is still the demon we have to fight in this country. Thank you so much for your question and for your contribution.
All right, thank you very much for that question and answer session. I don't know if there's any other person that want to ask question. If there's none, we'll be going swiftly to the third session of the presentation, where we'll be talking about breaking the cycle, legal framework, what our responsibility, then pathway to prevention. Please sit back and listen attentively because I'm bringing forward a human rights lawyer and gender advocate. She's widely recognized for her advocacy work promoting gender equality and combating violence against women. Please join me as I make welcome Barrister Gladys Emmanuel to take the next session, please. Barrister, over to you, please. Barrister Gladys,
all right,
the session is open to you.
Good afternoon, everyone. Can you hear me? Good afternoon.
Loud and clear, we can hear you.
Oh, great. Thank you so much. So permit me to share my slides. First, I must thank the organizers for this very laudable initiative. It is a timely conversation. I've also listened keenly to speakers before me, and they've done justice to the topic. So I have a single duty of leading us through legal frameworks And I would be looking at both national, regional, international, global standards. I would also take us through pathways to prevention. And finally, we would end up with community responsibility. So give me a minute. Let me share my slide. Okay, are we able to see what I'm projecting?
Yes, I can see your slide now.
All right, thank you so much for your response. Okay, my name is Gladys Emmanuel, and we'll be looking at child marriage today. My colleagues have done justice to all of this, so I would proceed from here. When we're talking of legal frameworks, of course, we cannot but make recourse to the 1999 Constitution of Federal Republic of Nigeria as amended. And of course, the Constitution expressly dies, but it provides for various rights. So if we look extensively at section 33 to 42 of the Constitution, we see things around our rights to life, we see rights to education, dignity of the human person, freedom from discrimination, and all of these things are things that child marriage undermines. Now, the Constitution goes further to throw us into an arena of deep thinking in section 29, subsection 4, paragraph B. And now it states, and I quote, "A woman is deemed of full age once she is married." We know what this means. Now, if you look at this particular quote extensively, it says someone is deemed of full age once they're married. Now, it doesn't go further to talk about biological age. So this particular section has been used extensively to justify child marriage in all its breadth. When we look again at the Child Rights Act of 2003, otherwise known as the CRA, permit me, I keep calling it act because I practice in Abuja, but in other states, you would hear things like the Child Rights Law or whatever name that the legislators in that state would want to ascribe to it. Now, this Child Rights Act of 2003, it's a domesticated version. So it means it's a minimized version of the United Nations Convention for the Rights of the Child, otherwise known as the UNCRC. It is also, it gets its life from the African Charter on the Rights and Welfare of the Child. Now, this particular law, the Child Rights Act, it sets 18 years as the minimum legal age for marriage. We can double check that in section 21. It also goes further in section 22 to 23 to criminalize betrothal and marriage of children. Now, that is where most of the regions in the country who continue to practice child marriage, that is what they do. You could hear Mr. A say, "Oh, my daughter is 5 years old. When she's 16 or 13, she will get married to your son." That is betrothal. They are already making decisions for the children or for that girl before she even becomes of age and is able to build her agency and decide what she wants for herself. Now, although Nigeria is a federation, the CRA, the Child Rights Act, only applies to states that domesticate it. So we hear lots of people say, "But we have these laws, why is it not operational in this state?" Nigeria is a dualist system. So although Nigeria has signed, it's a signatory to the United Nations Convention for the Rights of the Child, it needs your legislators or your the legislative arm of government to equally adopt that. and distill it into our local legislation. In the absence of that, what we will have is Nigeria is a signatory to A, B, C, D, but it has no force in the country. It cannot be used in courts when cases are being presided on. You can only make reference to them perhaps in reports and academic purposes. Then we see that also the CRA, not so many states have domesticated. So this already means that enforcement will remain uneven in states that do not even have it at all. Then we move on to the Marriage Act, otherwise known as statutory law. For those of us who want to double check in the laws of the Federation, you see it as Cap M6, Laws of Federation of Nigeria, 1990. Now, it also requires parents the ages. Okay, sorry about that. So the Marriage Act, can everyone hear me?
Yes, I can hear you clearly.
Perfect. All right. So the Marriage Act equally requires parental consent for anyone who is under the ages of 21, but it also does not expressly ban marriage below 18. Now, our constitution, like I earlier mentioned, gives us a bit of an idea that an adult is someone from 18 years and above. If we also look at the northern and southern region of Nigeria, they have what is called the Criminal Code and the Penal Code. Criminal Code for the south and Penal Code for the north. For the south, you see things around sexual intercourse with girls. Sexual intercourse with girls under 16 years is unlawful. But in northern Nigeria, the age of sexual consent aligns with puberty. This creates a dangerous situation. We all know that puberty varies from one person to another. Some might start developing biologically from like 9, others 12, some others 16. But now this particular law tells us that it aligns with puberty. So if you start to develop breast, you start to see your period, it means you're ready to get married. Then, of course, we cannot talk about issues of child marriage. Child marriage is a form of gender-based violence. We can't talk about it without looking at the Violence Against Persons Prohibition Act of 2015, otherwise known as the VAP. Now, VAP is a federal law. It criminalizes harmful practices, and that includes child marriage and forced marriage. Now, just like the Child Rights Act, it must be domesticated by the state for it to be enforceable. Now, as at 2025, we have, I think, one more state that has not domesticated. But even those who have domesticated, what is the level of enforcement? Are there funds? Are there the right committees set up? Take, for instance, there is a case of child marriage, you want to prosecute, you go to court. Do we have social workers accompanying that child bride to court? Or you leave them to face the very technical situations or atmosphere in the courtroom without understanding what is being said to them? So these are some of the challenges. Now, I have reeled out the national legislations we have. Now, what are some of those areas of tension or contradictions in our laws? The first, of course, is cultural and religious resistance. So laws that prohibit child marriage are sometimes perceived as Western or anti-religious, and they continue to create a pushback from influential traditional gatekeepers or religious leaders. Then we also have weak enforcement mechanism. So like I mentioned, CRA, VAP Act, enforcement weak. And then there is cultural resistance, there's limited resources, and there is lack of awareness. There is also constitutional ambiguity. I mean, I just read for us from section 29, subsection 4, paragraph B, where people continue to use this particular section to defend child marriage. Then we have statutory versus customary or religious laws. So Nigeria has an amazing legal system. There is a statutory law, there is customary law, there is also religious, or in some states called Sharia. So although the Marriage Act sets very strict conditions for statutory marriages, but sometimes we see in practice that both your customary and religious marriage, religious doctrines often override these provisions provided by this Marriage Act. We also see families in rural areas. They'll definitely get their daughters married under customary or religious laws. No one is going to look at statutory laws to get their children married under, because they know that it is prohibited, or some do not even know that it is prohibited. Then, of course, the elephant in the room, which is federal versus state laws. So Nigeria's federal structure means that states have legislative autonomy
I think the network is really bad at our end.
Just give her a minute to.
left.
Gladys, we lost you for a minute.
I'm not sure the African. Okay, so in Africa, we have the African Charter on the rights and Articles 21 of this particular legislation. Oh dear, can you hear me now?
Yes, we can hear you now.
Okay, I would have to quit sharing. My network is a bit unstable. Please forgive me. Bear with me. So under the African Charter on the Rights and Welfare of the Child, Articles 21 prohibits what is going on? Articles 21 prohibits child marriage. It also prohibits betrothal, and it sets the age of adulthood at 18. And it requests that state parties register all marriages. And of course, you can't register a marriage in your church or in a shrine. You have to register it in a court registry. So that way it's able to cut off child marriage practices. Then we have the Maputo Protocol, Protocol to the African Charter on Human and People's Rights and the Rights of Women in Africa. Article 6 mandates free and full consent and a minimum age of 18 for marriage registration. Then we also have the AU Joint General Comment, African Commission and African Committee of Experts on the Rights and Welfare of the Child. All of this legislation, they peg the minimum age at 18. Then for global standards, I've already talked about Convention for the Rights of the Child. Then we have CEDAW, Convention on the Elimination of All Forms of Discrimination Against Women, which requires equality in marriage and family life. The first speaker talked about child brides being being prone to domestic violence, which is very true because of the age disparity, sometimes the absence of resources, knowledge, and all of that. But with CEDAW is talking about equality in marriage. It's talking about equal treatment in family life. Then we also have SDG goals, SDG targets 5.3, which is a global commitment to eliminate child, early, and forced marriage by 2030. It's used as a benchmark currently for national projects or progress, I beg your pardon. So let's move on to prevention. What are the pathways to prevention? So the first is education and empowerment. We know, of course, that once girls are enrolled in school and then they are retained in school, chances of them being married off early is usually delayed. Then we have enforcement of Universal Basic Education Act, which strictly ensures that girls complete at least junior secondary school education. We also have safe space programs, where if girls are not able to go to school, they can at least learn a vocational skill, they can learn life skills, maybe skills around entrepreneurship, leadership, communication, digital literacy, policy advocacy, and the likes. Then we have legal harmonization. I just reeled out to us all the gaps in our laws. How do we bring them together? Right now, our legal landscape is very complex on this issue. So we have some states not even domesticating the CRA at the moment. We have the CRA saying 18 years is the age of marriage. We have the Marriage Act talking about anyone below 21 should seek parental consent and all of that. So there is a need for us to harmonize and then have this enforced in all 36 states. There is also a need for us to reconcile customary and religious laws or doctrines. So with this, we can work extensively with community gatekeepers, with lawyers, gender experts, those in academia, to ensure that local interpretations of laws, and whether it's customary laws or religious laws, do not in any way override the provisions of the Child Rights Act or various human rights provisions. Then, of course, there is a need for economic support for families. As much as it's startling to say, poverty often is one of the major drivers to child marriage. So there is a need for economic empowerment, economic support for the families. Currently, we have what is known as the Agile Project. Agile stands for Adolescent Girls Initiative for Learning and Empowerment. It's a World Bank project. It's currently operational in Kaduna, Borno, Kano, Sokoto, Jigawa, Bauchi, Gombe, Nasarawa, Niger, Yobe, and Zamfara states. So with the Agile project, families let their daughters go to school. The government gives them some form of money, some form of monetary or financial incentives. Then we have vocational training. It's very important to improve household income, so we could train the breadwinner of the family. That way they have larger streams of income, and daughters or bride price are not seen as a means to enrich themselves. Then finally, community responsibility. So we must engage as much as possible with traditional gatekeepers. In many cultures, gatekeepers wield much power. So we must engage with them. How do we do this? Advocacy is one tool we can use. Leaders can redefine protection of girls' honor. They can shift the focus from early marriage to education and maturity. Then also, it's very important to take these messages to our religious assemblies. So you could imbibe them in sermons, speaking extensively on issues around health, developmental risk of early pregnancy, and child marriage. This is one thing that my organization always does. We leverage the religious assembly. Nigeria is a very religious state, so that's where you get the number and then you start the engagement. Then there is community surveillance and reporting. So communities need to move from the standpoint of seeing child marriage as a private family matter, and then we look at it extensively as a gross human rights violation. We also need to set up child protection committees, especially for communities or states that do not already have that. So these are groups that could operate at ward level to identify girls at risk, intervene through dialogue, and then involve the authorities where the need arises. And of course, there is a need for survivor-centered support for the girls, especially girls who escape or girls who are removed from that early marriage arrangement. Some of them are often stigmatized. So there's a need for us to provide a survival-centered approach to be able to integrate them into society, send them back to school, and provide them with whether it's justice, access to justice, or psychosocial support. And finally, it will be male allyship. I like the fact that we have male men and boys represented on this call. It is very important it without involving men and boys. So we must engage men and boys in conversations about the benefits of girls being educated, the adverse effects of child marriage, and then breaking that toxic masculinity ideology, teaching men and boys about gender equality, the legal implications of marrying a minor, and overall creating a safer society for everyone. Thank you so much for listening. I really do appreciate it's an honor to share on this topic that is very dear to me. Over to you, madam.
Thank you, Barrister Gladys, for doing justice to that legal framework and prevention of child marriage. Thank you, really insightful session. We are most grateful. Let me give room for questions and query. Please, can you raise your digital hands if you have question for our barrister? Any question? All right. If there is no question at this junction, I want to say that Barrister Gladys already hit the nail on the head by saying it's our shared responsibility. Each of us has a role to play. As individuals, we must challenge harmful norms and speak up when we see or hear of practices that endanger young girls. We should not continue to say there is nothing much we can do. As educators and professionals, we should promote and support girls' education, as it is remain one of the strongest tools against child marriage. When you keep girls in school, then you are fighting against child marriage. As community members, we must engage parents, religious leaders, and policymakers to have a mind shift and enforce protective laws. And as advocates at your own end, use your voice both online and offline to raise awareness and drive the change. Conclusively, every girl deserves the right to grow, to learn, and to dream. Ending child marriage is not just about protecting girls. It's about securing the future of our society. Thank you very much for being my guest for this event. I really appreciate all our presenters, our guest speakers. Thank you for opening our eyes to see what could be done and what we need to put in place to ensure that our girls are not being married off even before the expected age. Please, I want to encourage you at your own end. Anytime there's opportunity for you to speak up, please do. When you see a girl that needs educational assistance, please assist. These are ways by which we can keep child marriage away from our society. We cannot continue to say the country is hard, things are hard, a lot of things are happening. Unless you speak up, unless you act, nothing will be done. So on this note, we like to bring the meeting to an end. It's already 1:30, and I sincerely appreciate you all for giving us this opportunity to discuss and rub minds together on this very important topic. Thank you very much, and we'll keep you posted and updated on our upcoming event. Thank you once again. Cheers.